Hello friends, sometimes the preterm babies, especially who are sick, may require platelet transfusions. In this webinar, we will learn about the details of platelet transfusion in preterm babies. Even though preterm babies require the platelet transfusion less often than the packed red cell transfusion, whenever they are required, appropriate guidelines should always be followed. Here we will understand the guidelines to be followed for platelet transfusion in preterm babies and procedure of giving platelet transfusion in preterm babies. So, now let us learn when we should transfuse these preterm babies with platelet. The table in the slide describes the guidelines for transfusing the platelets in preterm babies. Now, let us understand how one can follow these guidelines. To appropriately follow the guidelines, one should determine if there is any bleeding associated with low platelet counts by a detailed examination. The preterm who are bleeding should be transfused when the platelet counts are less than 50,000. However, if the baby has a major bleeding or is planned to go for a surgery, it is advisable to transfuse if the levels are less than 1 lakh. The preterm baby who do not have any bleeding only need platelet transfusion when their platelet counts are less than 20,000. Now, one can know when to give platelets to the preterm babies. Let us now understand some important considerations during platelet transfusions. All platelet transfusion should be cross matched. The platelet concentration should be given at 10 ml per kg. It is very important to transfuse the platelets immediately as soon as it is received from the blood bank. The rate of administration of platelet transfusion should be over a duration of 30 minutes. The baby may continue to feed during the transfusion. The maintenance IV fluids may be withheld during platelet transfusion, which can be restarted after the completion of platelets. Thank you.